And welcome back. Well, in October, we hear a lot about pink and breast cancer awareness, but it's also important to think green. Liver cancer may be talked about a lot less, but it's one of the deadliest cancers in the world. Joining us now to discuss this often overlooked cancer and the importance of early detection is Dr. Myron Schwartz, a liver cancer specialist, along with Tom Nealon with the American Liver Foundation. Good morning, gentlemen.
Good morning, Tiffany.
Good morning. You know, I find it interesting to learn about liver cancer. It's one of the cancers I don't think we talk about as often. What are some of the symptoms? What would someone notice if they were having an effect from liver cancer?
Well, they might notice that their belly is getting bloated, that they're turning yellow, but that's not really... by the time symptoms develop, the cancer is at an advanced stage and there's not a whole lot we can do. What we really need to make people aware of is the fact that we know who's at risk, and we can find it by looking for it, doing surveillance with ultrasound examinations every 6 months in people who are at risk. We can find the cancers at an early stage where cure is possible.
Who is at risk? How would you know to ask for an early screening?
People with any form of liver disease that's gone on over a period of many years are at risk. In the United States, hepatitis C is the most common cause of cirrhosis and liver cancer. Around the world, hepatitis B is a common infection. Many immigrants from Asia and Africa and the United States have this infection. Alcohol certainly over the years damaging the liver can cause cirrhosis, and increasingly the effect of obesity and diabetes causing fatty buildup in the liver can cause a cirrhosis just like alcohol. And whatever the cause, any form of cirrhosis, which is the end result of many years of liver damage, can cause cancer.
You know, I always think of the organ, of liver as an organ that is so regenerative, and it's one that, oftentimes can rebuild and repair itself. Why do you see cancer of the liver on the rise?
Well, it's the result of conditions that go on over 30 or 40 years. You're right, the liver is fantastic in its ability to recover from injury, but the damage and repair ultimately leads to a scar tissue buildup, and the things start to go wrong when the cells divide. The rise is because hepatitis C hit the United States back in the 1960s. It got into the blood supply, and an epidemic arose, and now 30 to 40 years later, we're seeing the peak incidence of liver cancer as a result. Increasingly, the other epidemic here in the United States of obesity and diabetes is causing a rise in cirrhosis due to fatty liver disease that causes liver cancer.
Tom, I want to bring you into the conversation and talk a little bit about screening and what you see with the American Liver Foundation as one of the barriers to people getting screened.
Well, I think, Tiffany, the largest barrier is people's general unawareness of liver cancer and its risks. And that's why our Are You at Risk program, in collaboration with Bayer Healthcare, is so important, because it's really intended to raise the profile of liver cancer, to bring a greater focus on the risk factors, and then encourage those people who have any of those risk factors to consult with their physician for early detection, because that's such a critical piece of the final outcome. And it somewhat goes hand in hand with the current CDC guidelines that if you're born between 1945 and 65, you should be getting tested for hepatitis C, and certainly anybody who is identified as having hepatitis C should consult with their physician to determine whether or not they are at risk of and whether liver cancer is present.
Well, and thinking green, I know, is one of the things that you, as a foundation, are doing to kind of bring more awareness. Doctor, Tom brought up some of the ideas of risk factors. What are some of the risk factors? Is it that diet? Is it alcohol consumption, hepatitis C? Are there other things that we should be aware of?
Well, those are the big ones in the United States. Anything that can cause injury to the liver over a period of years can cause liver cancer. It is a lifestyle and life choice disease. Alcohol in moderation, maintaining an ideal body weight, avoiding behaviors that can lead to the infections with hepatitis C. Most commonly these days, it's transmitted by intravenous drug use, and even a one-time use long ago can end up in a hepatitis C infection. So that these are the things you can do to avoid problems.
Where can we go for more information, Tom, especially with the Liver Foundation, so people can follow up on these risk factors and just more about liver cancer?
Well, Tiffany, thank you for asking. We encourage people to go to our website, liverfoundation.org, where there's a wealth of information about liver cancer and risk factors, and we're urging people to take charge and be advocates for their own health, and if they identify any risk factors, to be sure they consult with their physicians so that appropriate treatment can be undertaken in a timely manner.
Very helpful. Thanks for joining us, gentlemen. We appreciate it.
Thank you, Tiffany.
We really appreciate the opportunity. Thanks.
Absolutely.